Stop. If you're over 50 and experiencing itchy skin, don't scroll past. What I'm about to tell you could save your life. My name is Professor Marcus Fischer. In 30 years of medical practice, I've seen hundreds of patients who ignored simple itching. You know how it ended? Stage 4 cancer. Today I'm going to tell you the truth that primary care doctors don't share because they don't have time, because they don't care enough, and I cannot stay silent while people die from ignorance. Get ready. You're about to learn 7 symptoms you cannot ignore under any circumstances. 2 years ago, a woman came to my office. Sarah, 58 years old, complained about itching palms. She'd been applying creams for 6 months, thought it was dryness, aging. I looked at her hands and my blood ran cold, sent her for tests immediately. 1 week later, diagnosis, pancreatic cancer, stage 3. You know what she told me? Doctor, if I had known, I would have come earlier. So listen, so that you don't repeat this mistake. Hear every single word. Itchy skin in elderly people is not just itching, it's an SOS signal from your body, especially if you're over 55. The statistics are devastating. According to the National Cancer Institute, 30% of cancer patients had itching as their first symptom, long before pain, weakness, weight loss. But 95% of doctors and clinics just prescribe allergy cream and send you home, and the person dies within a year. Why does this happen? Let me explain simply. When a tumor appears in your body, it releases toxins. These toxins enter your bloodstream. Your liver tries to neutralize them, but when there are too many toxins, they start coming out through your skin. Result? Itching. Plus, cancer cells produce substances that irritate nerve endings. You feel itching, but you don't understand. It's not your skin itching, it's your nerves signaling. But the most dangerous thing is paraneoplastic syndrome. What's that? It's when your immune system tries to fight the tumor, but mistakenly attacks healthy tissues, including your skin. Itching, rash, redness appear. And people think allergies, dermatitis, but actually cancer. A study in the British Journal of Dermatology of 16,000 patients showed shocking statistics. People over 60 with chronic itching without visible cause had a cancer risk 4 times higher. 4 times. Now attention, I'll give you 7 specific symptoms. If you have at least 2 of them, see a doctor tomorrow, not next week, tomorrow. Symptom number 1, itching of palms and feet, especially at night. This is a classic sign of liver or bile duct problems, and this often means pancreatic, liver, or gallbladder cancer. Why specifically palms? They have a lot of nerve endings. When bile acids accumulate in the blood due to a tumor, they irritate these nerves first. If the itching intensifies at night, that's a red flag. At night, your liver works more actively, toxins accumulate faster. What to do? Urgently get tested. Bilirubin, ALT, AST, alkaline phosphatase, and abdominal ultrasound. Symptom number 2, whole body itching without rash. Pay attention, without rash. Skin is clear, but itches unbearably. This is almost always a systemic problem. 3 main causes: lymphoma, leukemia, or internal organ cancer with metastases. With lymphoma, cancer of the lymphatic system, itching occurs in 30% of patients, and often it's the only symptom in early stages. Why no rash? Because the problem isn't in the skin. The problem is in the blood. Cancer cells release histamine and cytokines. They cause itching directly through the nervous system. Patient scratches until bleeding, can't sleep at night. Doctors say, stress, neurosis, give sedatives. And 6 months later, stage 3 cancer. What to check? Complete blood count with differential, ESR. CT scan of lymph nodes, immediately. Symptom number 3, itching combined with jaundice. Jaundice is when skin and whites of eyes become yellowish, even slightly. If itching plus yellowing, that's pancreatic cancer in 70% of cases. 70%. What happens? The tumor compresses bile ducts. Bile can't exit, accumulates in blood. Hence the yellowing and intense itching. Pancreatic cancer is one of the most aggressive. No symptoms until the end. But itching and jaundice are early signs. Remember, jaundice isn't always bright. Sometimes it's a slight yellowish tint to the skin. Look at yourself in daylight. Better yet, take a photo and compare with one from a month ago. What to do? Pancreatic ultrasound, abdominal CT or MRI, tumor marker CA19-9. Urgently. Symptom number 4, itching of anal area or genitals in elderly. People are embarrassed to talk about this. Treat themselves with hemorrhoid suppositories. But this could be rectal or genital cancer, especially dangerous if itching is accompanied by blood in stool, change in stool shape, became thin like a pencil, frequent urges to use bathroom, feeling of incomplete evacuation. Rectal cancer in early stages causes itching. The tumor irritates nerve endings. In women, genital itching after 60 can be a sign of vulvar or cervical cancer. In men, prostate cancer growing into the rectum. Don't be embarrassed. Life is more important than embarrassment. What to check? Colonoscopy. Yes, uncomfortable, but it saves lives. Plus for women, gynecologist exam. For men, urologist and PSA test. Symptom number 5, scalp itching with patchy hair loss. Not just dandruff, but specifically itching plus hair falling out in patches, forming bald spots. This could be cutaneous lymphoma, rare but very insidious form of cancer. In early stages, it masquerades as dermatitis or psoriasis. Doctors treat with creams for years, but it's cancer developing. Key difference: regular antifungal and anti-inflammatory treatments don't help. Treating for 1-2 months, no effect? Run to an onco-dermatologist. What to check? Scalp biopsy. It's the only way to know for sure. Symptom number 6, itching with weight loss without dieting. Attention, if you're not trying to lose weight, not on a diet, eating as usual, but weight is dropping, that's cancer in 80% of cases. Itching plus weight loss, this combination almost always means cancer. Why does weight drop? Cancer cells devour your resources. They feed on glucose, proteins, plus they release substances that destroy muscle and fat. If in 3 months you've lost 10 pounds or more without reason, this is an emergency situation. Add itching, and the picture becomes almost definitive. What to check? Complete examination, full body CT with contrast, tumor markers, comprehensive blood tests, gastroscopy, colonoscopy. Symptom number 7, itching with enlarged lymph nodes. Feel your lymph nodes on neck, under jaw, in armpits, in groin. Are they enlarged, firm, painless? Painless enlarged lymph nodes plus itching. That's lymphoma or cancer metastases. Remember, if a lymph node hurts, that's usually infection, inflammation, not scary. But if a lymph node is enlarged, firm, doesn't hurt, that's cancer. With lymphoma, there's often a combination. Itching, enlarged lymph nodes, night sweats, low-grade fever, 99-100 degree F. What to do? Lymph node biopsy. That's the only way to know for sure. Now the most important thing, what to do if you have these symptoms. Step 1, don't panic, but don't ignore it either. Itching isn't always cancer. It could be diabetes, thyroid problems, kidney failure, allergies. But you must rule out cancer. Step 2, see a doctor tomorrow. Not your primary care physician. They'll prescribe cream and send you home. Go straight to a dermatologist or oncologist. Say, I have unexplained itching for more than 2 weeks. I need a complete examination. Step 3, insist on tests. Minimum set, complete blood count, biochemistry, bilirubin, ALT, AST, creatinine, urea, glucose, tumor markers, CEA, CA 19-9, PSA for men, CA 125 for women, abdominal and lymph node ultrasound, chest X-ray, or lung CT. If there are suspicions, full body CT with contrast. Step 4, don't believe it if they say it's just age. Itching is not normal at any age. It's always a signal of a problem. If a doctor dismisses you, go to another one. Your life is in your hands. Now, important information. There are types of itching that are not cancer. Itching from dry skin appears in winter with low humidity. There's flaking, goes away after moisturizing cream. Itching from allergies. There's rash, red spots, appears after contact with allergen, goes away with antihistamines. Itching from diabetes, often in groin, on legs, combined with thirst, frequent urination, elevated blood sugar. Itching from kidneys, facial swelling in mornings, cloudy urine, changes in urine tests. Itching from thyroid, combined with fatigue, weight gain or loss, pulse changes. How to distinguish dangerous itching. Dangerous itching lasts more than 2 weeks. Doesn't go away with regular treatments, intensifies over time, interferes with sleep, combined with other symptoms, weight loss, weakness, fever, enlarged lymph nodes. If even one point is yes, you need examination. Let me tell you another story. A man, 62 years old, won't name him, scratched his back for 6 months, thought, allergy to new laundry detergent. His wife convinced him to come see me. I looked, skin is clear, no rash. I asked, have you been losing weight? He says, yes, about 6 pounds in a month, but I'm itching, nervous, no appetite. Sent him for tests. A week later, diagnosis, Hodgkin's lymphoma, stage 2. You know what? We caught it in time. Chemotherapy, radiation, a year later, remission. Now he's living, enjoying life. If he'd come 6 months later, it would have been too late. Understand? Early diagnosis saves lives. According to World Health Organization statistics, stage 1 cancer is curable in 90% of cases. Stage 2 cancer, 70%, stage 3 cancer, 30% stage 4 cancer, 5%. The difference between life and death is a few months, those very months when you ignore symptoms. Now I'll give you a checklist. Save it. Check yourself right now. Self-check checklist. Do I have itching for more than 2 weeks? Yes, no. Doesn't itching go away with creams and antihistamines? Yes, no. Does itching interfere with sleep at night? Yes, no. Have I lost weight in the last 3 months without dieting? Yes, no. Do I have yellowing of skin or eyes? Yes, no. Are my lymph nodes enlarged? Yes, no. Do I have constant weakness, fatigue? Yes, no. Do I have temperature 99 to 100 degrees without cold? Yes, no. Do I sweat at night so much I have to change clothes? Yes, no. Has my stool changed? Color, consistency, frequency? Yes, no. If 2 or more answers are yes, see a doctor tomorrow. No excuses. If 4 or more, this is an emergency situation. Demand immediate examination. Now about prevention. What to do to reduce risks. Rule number 1. Regular checkups after 50, at least once a year. Complete blood count, biochemistry, abdominal ultrasound, chest x-ray for women, mammogram, gynecologist. For men, PSA test, urologist, every 5 years, colonoscopy. This saves lives. Colon cancer at stage 0 is treated with colonoscopy. Doctor just removes polyp and that's it, you're healthy. Rule number 2, monitor your skin. Any new moles, spots, non-healing wounds, show to dermatologist. Melanoma, skin cancer, is one of the most aggressive, but in early stages, it's 100% treatable. Rule number 3, healthy lifestyle. Don't smoke. Smoking increases cancer risk 20 times. Limit alcohol, especially hard liquor. Eat right. Remember my previous video about 5 superfoods? Apply it. Rule number 4, listen to your body. Any unusual symptom that lasts more than 2 weeks, reason to see a doctor. Nothing happens just because. Your body always signals. I want to say something important. I understand you're scared. Scared to go to doctors. Scared to get tests. Scared to hear a diagnosis. But you know what's scarier? Missing the window of opportunity. Cancer is not a death sentence if you catch it early. Modern medicine works miracles. But miracles are only possible in early stages. I've seen people who beat cancer, living 10, 20, 30 years after treatment, full lives. But I've also seen those who came too late, when nothing could be done anymore. It's terrible, it's painful, and it could have been prevented. Don't be among those who ignore symptoms. Take care of yourself. Your family, children, grandchildren, they need you. They need you healthy. So I'm asking you, if you have even one symptom I mentioned, see a doctor. Tomorrow, don't delay. Say, Professor Marcus Fischer said I need to get checked. Show this video to your doctor if needed. Main thing, don't ignore it. Your life is in your hands. If this video was helpful, hit that like button. The algorithm will show it to other people. You might save someone's life. Subscribe to the channel. There's a lot more important health information coming, and most importantly, share this video with family, especially with elderly parents. This could save their lives. Write in the comments, do you get checked regularly or do you ignore symptoms? Let's discuss. Remember, early diagnosis saves lives. Don't ignore your body's signals. Take care of yourself. Stay healthy. Live long and happy. Professor Marcus Fischer. See you in the next video.